Welcome to today's program entitled Fleas, Pet Annoyance and Public Health Issue. This webinar is produced by the U.S. Environmental Protection Agency's Center for Integrated Pest Management. The views expressed by our presenters are for educational purposes only and do not represent the official views or positions of EPA or the presenter organizations. This webinar is part of a series providing information on the importance of integrated pest management, or IPM, to community health and the information needed to establish and grow effective IPM programs. Welcome to today's program entitled Fleas, Pet Annoyance and Public Health Issue. This is Dr. Marcia Anderson with the EPA Center for Integrated Pest Management. I have the pleasure of being your moderator. This webinar is produced by the U.S. Environmental Protection Agency's Center for Integrated Pest Management. To put our topic into perspective, it should be noted that fleas transmit disease pathogens to both pets and people. This webinar will feature information of significance on fleas for school nurses and other healthcare professionals and facility managers. We emphasize the IPM steps that you can take to ensure the safety of students, patients, and families. The consequences of fleas will be discussed along with the prevalence of flea-borne illnesses. The importance of communication to parents about preventing child flea incidents will also be covered. Protecting the health of children is very important to the Environmental Protection Agency. Children face increased risks to their health when they're unnecessarily exposed to pests and pesticides. For this reason, the EPA recommends that schools implement programs that promote the safe use of pesticides and integrated pest management. By developing a coordinated IPM program, school leaders demonstrate their commitment to promoting a healthy environment where students are more productive. Effective pesticide safety and IPM programs address not only the safety concerns of using pesticides, but also the causes of why pests such as fleas may encroach on school grounds and be a problem at home, or why students can suffer from bites they receive from fleas on their beloved pets. At this time, I'd like to introduce our presenters. First, we will hear from Dr. Edward Wakem. Dr. Wakem is the Veterinary Service Manager at Siva Sante Animal and member of AVMA's Council of Biological and Therapeutic Agents. Dr. Wakem received his BS and Doctor of Veterinary Medicine degree at Michigan State University and did his postgraduate residence at the University of Connecticut. He has over 25 years of clinical experience in companion animal practice. Formerly with Bayer Healthcare's Animal Health Division and Fort Dodge Animal Health, Dr. Wakem's area of interests are infectious diseases of companion animals, vaccinology, and risk communication. Next will be Dr. Marc Lame. Dr. Lame is a clinical professor with Indiana's University's School of Public and Environmental Affairs and director of their Master of Science Environmental Science program. Dr. Lame holds degrees in agricultural entomology and public administration. He was an extension IPM specialist at the University of Arizona for 10 years and an administrator for Arizona Department of Environmental Quality before joining Indiana University. Dr. Lame has implemented school IPM programs in 23 states over the past 21 years. Dr. Wakem, we will now begin discussing the problems with fleas and pets. Dr. Wakem, please take it away.
Thank you, Dr. Anderson, for that warm introduction. I'm proud to be able to represent the American Veterinary Medical Association and its over 91,000 members. Founded in 1863, the AVMA is a diverse and passionate group of professionals striving to improve the health and well-being of animals, humans, and the environment that we share. In the next 30 minutes or so, I hope to help you better appreciate the flea, not only as a member of the insect class, but also as a blood-feeding parasite and vector of disease agents, that is, a carrier or an intermediate host of disease agents. Due to its negative effects on health and wellness, we will also explore the means to control flea infestations and the challenges inherent in that task. These early prehistoric fleas may have behaved more like a louse than the fleas we know today because they lacked strong jumping legs, but they were about 10 times the size of today's fleas, and yes, they did feed on large hosts like dinosaurs. These ancestral fleas are extinct, and in their wake are over 2,000 species that parasitize mammals and birds worldwide, with over 300 species in the United States alone. Fortunately for today's discussion, one species, Tennocephalides felis, will be our focus, also known as the cat flea. Despite its name, the cat flea is a parasite of both dogs and cats. Fleas can be and have been more than just a nuisance. Historically, the Black Death flea, which Dr. Lane will discuss in greater depth, was responsible for over 100 million deaths. As stated earlier, the flea is an insect possessing 3 body segments and 3 sets of legs, the last pair modified for jumping. And good jumpers they are, exceeding 8 inches vertically and 15 inches horizontally, able to cover small dogs and cats in a single bound. Jumping is important since they lack wings. The flea's body is laterally compressed to facilitate its scurrying about an animal's hair coat, and it is covered with a tough chitinous shell, and at 2 to 8 millimeters in length is about the size of a sesame seed. The flea infestation of your household pets originated outdoors. Although fleas jump high and far, their movement on hosts is passive. That is, they hitch rides on their mammalian hosts. These hosts pictured here are common suburban and rural wildlife species that support the flea life cycle. As they seed the environment about your home with immature life stages, household pets are infested by newly hatched fleas. It is unlikely that an adult flea jumps from one host to another. Although no life stages of the cat flea can survive extended exposures to freezing temperatures, they can stay quite warm and comfortable on their hosts. The life cycle can progress in protected environments like homes and dens. This is the flea's life cycle, a progression of the developmental stages of the flea. Understanding this life cycle, or that of any other parasite, is essential to successfully dealing with that parasite. The stages that you see here are common to all insects. The adult flea lays eggs or ova, which hatch into free-living larvae or maggots. After 3 larval stages of development, a pupa lives in a cocoon until emerging as an adult flea. An adult flea, newly emerged from the cocoon, can loiter for up to 2 months without a blood meal. Once the adult acquires a host, feeding occurs within the first day and egg laying soon thereafter. Once that first blood meal is taken, the adult flea must continue to feed, and if dislodged from a host, they cannot survive more than 24 hours. An adult flea stays on a host until it is removed or nears the end of its lifespan, which is about 100 days or more. Fleas are hungry and active and require a great deal of blood each day, 15 times their body weight. 72 female fleas could consume 1 ml of blood per day, which means that 2,160 fleas would consume an ounce of blood per day. The flea mouth has parts that pierce the skin and enter small blood vessels to draw blood. The brown material you see in the screen is flea feces, which drop onto the pet's environment and they feed the larval stages. These flea feces, also known as flea dirt, are called frass. This dried, partially digested blood is reddish-brown. When wet, it will look blood red. Frass is sometimes granular and sometimes coiled like a candy cane. The first week or so of adult flea blood meals results in granules or spherules of frass, and over time, the coil or candy cane shape predominates. This is an examination of frass may indicate the duration of an infestation. Fleas feed on blood and make new fleas. Egg production begins soon after feeding, and as long as blood meals are available, continues throughout the flea's lifespan. 40 to 50 eggs per day is possible, and over an average lifespan, nearly 3,000 eggs can be produced by a single flea. The flea egg, laid individually and always on the host, are moist but quickly dry and drop off the host. An infested pet is like a salt and pepper shaker, dropping white eggs and brown frass into its environment, particularly in its sleeping and resting areas. Depending on the color of the background, both are easily seen. The eggs are less than 1/2 millimeter long and are white and moist when fresh, drying to a pearlescent sheen. Under ideal conditions, 77 degrees Fahrenheit and greater than 50% relative humidity, the eggs hatch as early as 36 hours post-laying. Cold temperatures kill eggs, as do high temperatures, and eggs do not survive at low relative humidities. This helps to explain regional differences in flea pressure. Remember, however, that there can be man-made microclimates that support fleas within surrounding less hospitable conditions. Microclimates can be created by landscaping and climate control in dwellings. As you watch this larva emerge from the egg, note the egg burster spine that the newly developed larva uses to cut open the eggshell. The third life stage of the flea is the larva or maggot, which has 13 segments and is 2 millimeters long right out of the egg. Each segment has bristles and the head end is darker than the tail end. Larvae will actively crawl away from light, so in a home setting they are likely to be in crevices, under furniture, in rug pile, and between cushions. Larvae go through 3 stages or instars, more than doubling in length. Because they eat flea frass, their gut contents are often reddish-brown. Larvae are free-living and can be seen here scurrying through the carpet pile. Since they hatch from eggs deposited from the pet's fur in close proximity to frass, remember the salt and pepper shaking metaphor, food is readily available at hand, even if that means eating flea eggs or even each other. When the larvae complete the third instar stage, they are ready to spin their cocoon, which they can complete in 6 to 7 hours. Once safely secured in the cocoon, the metamorphosis to the pupal stage begins. The larval cuticle remains within the cocoon. Cocoons are about as long as the third instar larva, 4 to 5 millimeters. The white silk spun by the larva is sticky and picks up nearby debris, which effectively camouflages the cocoon. These irregular granular masses in the pictures would not be readily identified as flea cocoons. The pupa is snug in the cocoon, motionless and dormant. Over 3 to 6 days, the pupa transitions into the adult stage. In the cocoon, the pre-emergent or farrate flea is waiting to emerge. The farrate flea may remain quietly in the cocoon for a very long period of time. This stage of the life cycle is the longest and most durable. Stimuli to emerge from the cocoon include carbon dioxide, warmth, pressure, vibration, sound, and shadows. Exit from the cocoon is quite rapid, and if emergence is incompletely triggered, the quiescent stage within the cocoon is reestablished. Consider the cocoon with farrate flea in a home environment. What can provide the triggering for flea emergence? Normal foot traffic, machines like vacuum cleaners, appliances, and home entertainment equipment come to mind. Here is depicted the flea pyramid. We have addressed the flea life cycle, and there are the stages with their relative density. There is considerable attrition in the egg and larval stages since they are subject to environmental conditions. There is less attrition, however, of the pupal stage within the secure cocoon. The total environmental and on-host infestation is referred to as the biomass of the flea infestation. For adequate control, the entire biomass must be addressed. If we turn that pyramid upside down, we have the flea funnel. Feeding eggs, larval stages, and cocoons into the funnel produces adult fleas. 95% of the biomass produces 5% as adult fleas. To conclude the flea life cycle discussion, consider the time involved to produce a new flea. In average conditions, the 77 degrees and greater than 50% relative humidity that was mentioned earlier, egg to flea can take 3 to 4 weeks. Ideal conditions can accelerate the cycle to 2 weeks, and in the case of very long pre-emergent flea quiescence within a cocoon, remember up to 175 days, the entire flea life cycle may be greater than 6 months. As wonderful and awe-inspiring as the flea life cycle is, the reality is that the cat flea is a parasitic insect that feeds on blood, can vector disease, and in general deteriorates the quality of life for the pets and their families. It becomes our job to rid the pets and their environment of fleas. Integrated flea control uses multiple control strategies simultaneously. The tactics of integrated flea control target the various life stages that you have seen on previous slides, both on the host and in the environment. Integrated flea control is a very specific application of integrated pest management. Integrated flea control has 4 pillars. One is education of the pet owner who has the flea infestation, who will be doing the majority of the work. More about this later. The adult flea needs to be targeted. Even though it is 5% of the biomass, it feeds on blood, causes distress, and lays eggs. Another pillar is the 95% of the flea biomass that are immature forms and that need to be eliminated or at least reduced in mass and volume. Lastly is environmental hygiene. Since 95% of the flea biomass is off the host in the environment, efficient resolution of a flea infestation requires environmental hygiene. Understanding these windows is key to setting realistic expectations of success. Remember, the farrate or pre-emergent flea lives quite safely inside the cocoon for over 6 months. The pupal window is the time required to exhaust this environmental stage of the flea life cycle. The developmental window is essentially a dynamic expression of the flea life cycle during an ongoing infestation. Although the cycle itself can be 2 to 4 weeks in length, an infestation has thousands of life cycles occurring simultaneously and sequentially. Assuming all tactics of integrated flea control meet the strategic goals in an ideal fashion, a flea infestation requires a minimum of 12 weeks to manage. Here is our cat flea life cycle with control tactics overlying each stage. Adult fleas are susceptible to insecticides and ectoparasiticidal drugs. Flea eggs can be managed, or more specifically, hatching prevented by insect growth regulators and developmental inhibitors. Larvae are susceptible to insecticides, and their development is inhibited by insect growth regulators. The cocoon protects the pupa inside from chemical attack, so physical removal from the environment is the best tactic to employ for cocoons. As said earlier, the first pillar of integrated flea control is pet owner education. The better the flea life cycle is understood, the better the pet owner can understand and perform the tasks assigned. The veterinary healthcare team needs to be passionate about flea control and communicate that passion with intellectual and moral support. Here is what you are doing well, and here is what could be better. Right from the start, set realistic expectations based on the developmental and pupal windows. Be sure to treat all contact animals, not just your favorites, and this includes animals in the house or homes of relatives and friends that may be visited. The adulticide targets the 5% of the biomass that is the adult flea. EPA-registered pesticides specifically labeled for use on that specific species are available as shampoos, sprays, powders, dips, spot-on liquids, and collars. These products may or may not have repellent properties as well. The flea is killed by contact with the pesticide compound as it breaches the exoskeleton. Depending on the compound, there may be both immediate and persistent effect on the adult flea. These products applied to the pet may drift on hair and skin scale to the environment where larvae can be targeted. Examples of such EPA-registered pesticide compounds are pyrethrin, carbaryl, permethrin, dinotefuran, imidacloprid, and fipronil. FDA-approved ectoparasiticidal drugs are systemic, that is, they are administered or applied to a pet and are absorbed into the bloodstream. When a flea takes a blood meal, it ingests a dose of the drug and dies. Examples of these FDA-approved ectoparasiticidal drugs are afoxolaner, fluorolaner, sarolaner, selamectin, and lotilaner. Insect growth regulators are applied to the environment, or more commonly onto the pet, mixed with an EPA-registered pesticide product. IGRs, insect growth regulators, are EPA-registered. These products affect the largest portion of the flea biomass, the eggs and larvae. Since the egg is laid on the host, the IGR contacts the egg before it dries and falls off. IGRs on pet hair and dander falls into the environment. The IGR is a juvenile hormone mimic which stalls the life cycle development of the immature flea stage. Examples of such products are pyriproxyfen and S-methoprene. An insect developmental inhibitor, lufenuron, is an FDA-approved drug administered to pets. A feeding flea treated with lufenuron lays eggs that cannot hatch because the development of the flea burster spine, seen in that earlier slide, is inhibited. 95% of the flea biomass is environmental, and this includes the frass that provides food for larvae. The cocoon is the most durable of the three stages. Indoors, the flea eggs, larvae, and cocoons are on floors, both carpeted and uncarpeted, in and on furniture and bedding. Removal with vacuum, sweeping, Swiffer-like devices, and wet mops can be effective, as well as environmental application of pesticides and IGRs. Concentrate on pet resting and sleeping areas. Remember, 1, that larvae seek dark areas, and that 2, cocoons can release their ferrate fleas as a result of stimuli such as cleaning. Outdoors, focus on dark, damp areas close to the house where wildlife may travel and pets rest, seeking coolness and shade. Fleas will not develop out on a sunny lawn. Removing leaf litter and plant debris to encourage light and drying and application of chemical control are feasible steps. Excluding wildlife is often easier said than done. Flea control is necessary, and a great deal of time and effort is devoted to it because fleas are a nuisance and pose a potentially serious health risk to pets and people. Loss of blood, skin rash, loss of hair and allergy, transmission of parasites, and disease agents are all possible consequences of flea infestations. With the risk of these diseases is not universal. There can be local concentrations. Your veterinarian is the best source of advice on questions for any of these conditions. Flea saliva can trigger an allergic reaction in sensitized pets, and more bites mean more saliva. Flea allergy can occur simultaneously with pollen or food allergies, worsening the expression of the condition. Flea allergic pets may not have many fleas, but may still suffer intense itching, red skin, hair loss, and rash. Because cats self-groom, fleas may be hard to find, so absence of fleas on a cat does not mean absence of a flea infestation. The flea or cucumber seed tapeworm, Dipylidium caninum, is carried by fleas. To summarize this complicated life cycle, a pet with tapeworm sheds egg packets in its feces, which are eaten by larval fleas. The larval flea, now infected, grows to an adult and is ingested by a dog or cat, completing the life cycle. If a human, usually a child, were to eat an infected flea, the human can also develop the tapeworm. Fleas are blood-feeding insects. 1 ounce of blood can be lost with the infestation of a little over 2,000 fleas. Puppies and kittens, because of their size and low iron reserves, can suffer life-threatening anemia. Seek advice from a veterinarian immediately if a pregnant dog or cat has fleas, or if your litter of puppies or kittens have fleas. Cat scratch disease is caused by a bacterium called Bartonella henselae. Fleas facilitate the transmission of the bacteria among cats through blood feeding and frass. Humans can become infected by contact with infected fleas, which involves broken or damaged skin surfaces. Concerned pet owners need to seek out human and veterinary healthcare providers willing to work in a collaborative effort to offer advice, diagnosis, and treatment. Plague, caused by a bacterium Yersinia pestis, is maintained in a natural life cycle with fleas and small mammals. As we have said, fleas of wild mammals can be shared with pets in the peri-domestic setting. Dr. Lame will cover this threat in greater detail. Our understanding of fleas and their biology, specifically as it applies to pets, has grown tremendously even during my career as a veterinarian. The strength of the human-animal bond has been reinforced by scientific advances in flea control. Our ability to intervene with products that safely and efficiently deal with flea infestations has shaped the way we now view dogs and cats as valued members of our extended families. Thank you for listening and for the opportunity to represent the expertise and compassion of the veterinary profession in the AVMA. Remember to consult your veterinarian for advice on flea infestations and any other health concerns of your pets.
Thank you, Dr. Wakem, for your very graphic portrayal of flea biology and why and how they affect our pets. Next up is Dr. Lame, who will discuss the public health issues with fleas. Dr. Lame, the mic is yours.
Thank you. I appreciate it. Dr. Wakem, that was great. I certainly learned a lot. Probably one of the most important things that we all need to be getting out of this is that fleas, like many other insects, have evolved to survive and thrive. They can, their life stages protect them, and so we have to have an integrated approach. Before I get into that, I do want to talk about the public health. Most of us know that the flea is responsible for a number of different diseases. I didn't get into the Latin names on these. I'm using the more common names that are mostly associated with these different diseases. We have viruses, we have bacteria, as you can see under the disease column. They even can, of course, be mechanical vectors of salmonella. Of course, the plague is something that we've heard about. Lately, we've been hearing about marine typhus, and as Dr. Wakem mentioned, we can have tapeworms, and then of course filariasis. And this covers a number of different types of fleas. The ones that we'll talk mostly about for the rest of this are the fleas that are associated more with humans and the mammals that we come in contact with. So the bubonic plague, let's kind of get into the tough stuff here. So the most common form of the Black Plague is the bubonic plague, and we'll talk about that. There are 3 different forms, actually. The mortality rate during the Black Death was 30 to 75%, depending on where folks were. They presented with enlarged and inflamed lymph nodes. Typically, those, of course, are located in the armpits, neck, and groin. They were called buboes. Then headaches, nausea, aching joints, fever, vomiting, bleeding under the skin, causing those dark spots to appear. Some people say that that is where the Black Plague name came from, and they took from 1 to 7 days to appear. This was here's some pictures of these guys. You can see the buboes. This was a particularly devastating disease. This is something nobody would want to get. These, again, going through the progression, it just gets worse and worse. Interestingly enough, if the buboes broke, the victim actually had a better chance of living. So that was kind of an interesting thing. Very painful way to die. So that's ancient times, right? Well, actually, we have 2,000 cases annually, give or take. And we actually have epidemics that do occur. And the last one that I was aware of is in Madagascar, year before last. This was associated with, of course, it was bubonic plague that went to pneumonic plague, and it had to do with the behavior of the people, their cultural beliefs in being close to the dead bodies. And of course, every year we find plague organisms, fleas, and the actual plague disease in the Southwest. More often than not, it's New Mexico or Arizona. And as you can see here, these are just some examples of what we see typically in the middle or the end of every summer, reports of these. So what causes the plague? Well, pretty much, we can say, of course, there is that pneumonic where people are coughing and getting sputum, but by and large, bubonic plague is created by fleas where they transmit the disease. Typically, the Oriental rat flea is the culprit here, although in different parts of the world and in different times in history, we've even had the human flea that can transmit this. During the Dark Ages, we were assuming that the black rats, which were more prominent at that time, were the reservoirs. And of course, these black rats have been displaced in some areas and actually have become more established in other areas, more coastal zones. So we've talked more about fleas jumping, so they can move. Again, typically these are usually newly hatched fleas as opposed to moving from body to body. So another diagram, as you can see, the transmission of the bubonic and septicemic plague is where humans are infected, and then the pneumonic plague here. Interestingly enough, we often, and you will hear when we talk about murine typhus and some other diseases where the disease is transmitted by the flea, but through its feces with the black plague or with the bubonic plague, it was actually the flea gets the disease and its digestive system is blocked and it actually can't eat, and it gets ravenous, and that's why it really is attacking any kind of host, but it's also regurgitating because of that blockage, and that's how the transmission occurs. You've seen this diagram. I think what I would add to that is the idea that these are episodics that occur in the wild. They naturally occur, and when humans are introduced into that episodic, then we become part of it. Cats are particularly susceptible, but rodents are the major culprit. Where we see the plague out in the Southwest, normally that is associated with prairie dog towns, and humans, of course, are encroaching on those habitats. So we're seeing a little bit more plague exposure because of that. Moving to marine typhus. So I'm basically picking these two epidemics that can be that are here in the United States associated with fleas. Of late, we've had marine typhus in Texas and in California for years. There has been a more or less an explosion to a point where the health departments will call it an epidemic in the Los Angeles area, specifically Pasadena. And we'll talk about why that might have happened. And of course, we're seeing more cases as well in Texas. Marine typhus is also called epidemic or endemic typhus or flea-borne typhus. It's a disease caused by a bacteria. It's spread to people through contact with infected fleas. People get sick with marine typhus when infected flea feces are rubbed into cuts or scrapes in the skin. Most areas of the world, rats are the main animal host. Cat fleas found on domestic cats and possums have been associated with cases of marine typhus, and most cases of marine typhus in the United States are reported in people in California, Hawaii, and Texas. Symptoms begin within 2 weeks after contact. Fever, chills, body aches, muscle pain, loss of appetite, nausea, vomiting, stomach pain, cough, rash. Most people recover without treatment, but in some cases, their disease can be severe. Well, when left untreated, severe illness can cause damage to one or more organs, including liver, kidneys, heart, lung, and brain. These are obviously advanced symptoms. The initial symptoms, like many other diseases, particularly bacterial diseases, can resemble each other, so we can get confused with this. So let's talk about flea-borne disease prevention. Always wear gloves when you're handling sick or dead animals. Of course, use EPA registered repellents like DEET and permethrin. Keep rodents and animals away from your home, workplace, and recreational areas. So this is where IPM, beyond flea IPM, becomes particularly important. And of course, keep those fleas off your pets. So let's go back a little bit and talk about what IPM is. All kinds of people have all kinds of definitions. Over the years, I have basically learned to define integrated pest management as don't attract pests, keep them out or off in the case of animals, get rid of them if you're sure you have them with the safest, most effective methods. You'll see the vacuuming here. And of course, this is Dr. Corrigan with a roof rat, black rat. So I always show my IPM house. Basically, IPM is shifting from a reliance on pesticides to an integrated approach that does include pesticides sometimes, but certainly is based on other ways of monitoring pests. The difference that I think Ed did such a great job with is this idea of education, and that's the key to integrated pest management. Foundation is education, so we need education with regard to identification, biology, monitoring, prevention, and treatment. Actually, Dr. Gouge in Arizona and her colleagues have just released last month, they published this roof rats, pathogens, and parasites. This has some great education with regard to one of the major reservoirs and hosts of fleas. So in general, with this, when we talk about this, again, really working in the built environment, we're talking about cultural control, chemical control, and mechanical control. Cultural control is, one way of looking at that. The major way is sanitation, and mechanical is looking at exclusion. Again, we need to know about the flea, but we also need to know about the other hosts or reservoirs and their habitat as well. And so that's particularly important. IPM for fleas is you need to know, and IPM for any pest is you need to know the conducive conditions. You need to be able to monitor for both fleas and their hosts. Then there's cultural control with mostly sanitation. I will use the word squalor as we get into this or complete this talk. It's the main way that we can manage pests is by not providing food, water, shelter. And then exclusion and mechanical control, and then finally chemicals, and we'll talk about each one of those. Conducive conditions for pests. Borrowing from the University of California, outdoor flea populations are most prevalent in coastal localities and other places with moderate daytime temperatures and fairly high humidity levels. So this goes along with what Dr. Wakem was discussing. I typically see fleas into the fall with the higher humidities and when the temperatures are going down a bit, so that's when fleas present here and also in the south more. We look for conducive conditions or areas with host populations, rodents, but also dogs, cats, possums, and of course squirrels. Our rodents, ground squirrels out west, and tree squirrels in other parts of the country. Populations can become very numerous in shaded and protected areas such as sheltered animal enclosures. So burrows is something that we talk about a lot, particularly in plague control, whether it's prairie dog burrows or burrows of marmots and other burrowing rodents. That is particularly important, as was mentioned earlier. That's a protected habitat where the fleas can overwinter without freezing. Crawl spaces under buildings can be ecological equivalents, but they also, not just for fleas, but certainly more importantly for feral animals, raccoons, possums, and whatnot. In certain parts of the world, ferrets and vegetated areas adjacent to buildings. So squalor and overcrowding is going to get worse with global climate change. And so global climate change is a conducive condition for fleas and the associated diseases. Monitoring. So we know our conducive conditions. Now we monitor, and this is actually a very simple thing, but still, I actually still use this, is to test if a yard or a room has fleas. I wear white socks, and the fleas will jump on them, and you will see them. So that's an interesting way, as was mentioned before. They're coming right off of the carpet, and they're usually pretty darn hungry, and they're stimulated, and they will jump on you. You can use a trap, and I'll show a picture of that. Basically, you put a container, a shallow container with water and dish soap next to a light source, and which is near where the pet resting area is, and that will present with fleas if there are some around. Again, you want to look out in those areas where feral animals might be, and of course monitor your animals. As the picture showed earlier, you actually separate the fur and you see this flea dirt. If you can collect some of that dirt and put water on it, it will turn red, as was mentioned. And so that's one of the ways that we would monitor for fleas. I would combine all of these things, and they will tell you whether you need to go to the next step with regard to flea management. So cultural control, which is to number one, have an effective integrated pest management rodent plan. I believe there's going to be some, and have been some good webinars on rodent, IPM for rodents. This is probably number one for trying to prevent fleas other than dealing with your pets. You want to not have clutter near the house. You want to vacuum carpets. As far as cleanliness goes, now this is cultural control. Mechanical control also includes vacuuming. Don't leave pet food outdoors. Don't provide food or water for wild animals. Maintain the yard free of debris. As I mentioned, clutter. Keep garbage containers tightly covered to avoid attracting pets, and close up crawl spaces and openings under the home where rats and stray animals can sleep, hide, or find food. If you have a yard, if you can exclude wild animals, try to do so, and certainly limit their access to homes, and keep an eye on the placement of animal resting areas. As far as you wouldn't want to have that next to an entryway into a house. More mechanical control, launder and dry bedding, rugs, towels, blankets used by pets. Regularly vacuum carpets, rugs, bedding. So that vibration will trigger adults to emerge, which is good for control measures. And then that flea trap that we talked about. Chemical control for fleas. It's been my experience over the years that fleas are really prone to resistance. So when I talk about chemical control, I personally always try to make sure that I consider resistance management, and I never use bug bombs. So that's just the starters. In the summer season, when pets are active, it might be necessary to treat the yard for fleas. Certainly in the last decade or so, topical treatments of pets seems to really work well, although resistance is occurring out there, and always treating animal beds is something that is good, whether it's with IGRs or some of the more traditional pesticides. I often prescribe dust. There are the oral veterinary drugs, which are fairly new and effective. There are some problems with the toxicity, and so this is something that you need to be aware of. And of course, that toxicity can occur whether it's a oral drug or a topical pesticide, and it's something that pet owners always need to keep an eye on and discuss with their veterinarians. Non-chemicals, and this is more for off the animal habitat. Diatomaceous earth works as a desiccant or as an abrasive, and it can be sprinkled into corners of rooms near furniture where pets often sleep, and then vacuumed. And then there are parasitic nematodes that are labeled against flea larvae and pupae in yards and gardens. So that's interesting. So flea-borne disease prevention, to conclude, is that epidemics require active leadership to implement community action. So this, whether it's in a school or, more often where I have seen in a community situation with flea infestations are with shelters. I know I've dealt with a few of them with women's shelters, and then also elderly care. Oftentimes pets, particularly cats, are in those environments as opposed to in the school environment, but nonetheless, the school environment, good old ferrets, Anyways, public health protocols, when we deal with epidemics, is looking at awareness, surveillance, ethical response. These are again what we've talked about here, which is this idea of we want to have education, monitoring, and a protective communication. We need to know what's really going on, as opposed to a number of different ectoparasitic problems, whether it's lice, whether it's bed bugs, where people try to hide that. We need to know what's going on. That's part of the problem that I believe they're having with marine typhus in California right now, where they need to further address squalor and overcrowded and admit that there's a problem. This squalor and overcrowding will get worse with global climate change, so we can expect to see a bit more of this.
If you missed any of our previous webinars or wish to recommend them to colleagues, please visit our website for links to on-demand viewing. Now on to your questions. The first question is, what stage of the flea can be effectively damaged by diatomaceous earth? Marc, would you like to take that one?
What flea can be controlled with diatomaceous earth?
Yeah, what stage of the flea?
Oh, well, actually, any of the stages. Well, that's not true. The larval stage and the adult stage, where whenever the chitin or the chitinous exoskeleton is abraded, and particularly the softer parts in between the chitinous plates is abraded, then the insect or the organism will lose fluid and dry up.
Okay. Next, what should a school do if they notice a student who either has flea bites on them or if they notice actual fleas? Is there a difference in how to approach it?
From my point of view, if they have flea bites, that's something that could be dealt with at home. Personally, I am not very good. People say they know how to tell the difference in bites, and I've never been very good at that. So I'm always suspect. But if the flea itself is there, then the school needs to deal with it, because the fleas obviously can then lay eggs, and if there are possible hosts around, possibly humans, but more so classroom pets, etc., then you can develop a flea infestation, which we occasionally do see.
Yeah, I agree with Dr. Lame. A red itchy lesion on human skin can be due to a wide range of causes. So just the fact that the student may have such a rash should be brought to the attention of the school nurse, and then an investigation can be made. Finding fleas on a human being, those fleas should be removed. They should be identified by a competent individual, because a human being is not a suitable host for the cat flea. So if a flea has taken residence on a human being, then we may be dealing with a different species of flea, and the consequences and management tools are very, very different there.
Okay, I have a question here for Dr. Lame. Can you expand on the genetic component in your IPM house? Is the word genetic synonymous with resistant?
No, not necessarily in that case. There is genetic resistance without a doubt, but when we think of it as a control measure that can be integrated with other forms of pest management, like cultural control, mechanical control, chemical control, etc., we think of it as instead of the pest organism being resistant, that the host can be resistant. This is often used in agriculture with resistant plant varieties and that kind of thing. So that's where the genetic control comes in. In the last decade or so, that that has been utilized sometimes in terms of genetically modified organisms and that, but typically we don't think of that, particularly when it comes to the built environment and human pests.
Thank you. Here's another one. As part of IPM, when house pets are treated with monthly flea medicines, is it best for them to remain on these medicines year-round, or is it okay for them to go off the medicines during the winter if, say, one lives in a cold climate? Dr. Wakem, can you answer that one?
Sure, be happy to. It's really uncertain when flea season begins and when flea season ends. And so many veterinarians recommend year-round protection for dogs and cats against parasitic disease threats like fleas, ticks, heartworms, intestinal parasites, or a wide range of parasitic threats. Certainly fleas cannot survive outdoors in temperate climates during the winter time, but as we said in the presentation, they do survive in the protected environment that is the animal's fur and the animal's den. And it's very possible that a pet may not need flea protection 365 days of the year, but they may need it 12 months of the year. So since it's really uncertain, again, when that season begins and when that season ends, follow your veterinarian's advice. They are the best. They're in the best position to advise on regional, local differences in flea and tick presentations. Flea and tick medications are combined together, and ticks do pose a year-round threat, whereas fleas may not. But again, it's very, very difficult to separate flea protection from tick protection since they're very often the same compound or the same product. So to summarize my very long answer, year-round flea and tick protection for pets is generally recommended by most veterinarians in the United States.
Thank you. Can you comment on the efficacy of selamectin and side effects?
Selamectin belongs to a drug class called macrocyclic lactones, and it is available as a spot-on liquid for dogs and for cats. The active ingredient in the liquid is absorbed across the skin, and it becomes systemic so that the flea ingests the selamectin in the bloodstream and the flea dies. The products containing selamectin generally have few side effects. The products have been on the market for well over a decade and have been used in large numbers of dogs and cats, from youngsters to elderly animals. Selamectin is also effective as a drug to prevent heartworm in dogs, heartworm in cats. Also, it manages intestinal parasites and ear mites in cats. So it is one of many excellent choices that veterinarians have to choose from to control both external and internal parasites in dogs and cats. It has performed well in peer-reviewed published studies. And so if that is what the veterinarian is recommending, I would certainly have no qualms about following the veterinarian's advice. What products like selamectin do not include is an insect growth regulator, for example, to provide that integrated flea control tool. So if Once pet is on a selamectin-containing product, one may want to have a discussion with the veterinarian about additional application of a product with an insect growth regulator to provide that environmental control of that flea biomass, should that be necessary.
Thank you. How should a school nurse proceed when a student is found to have several, such as 10 or more, fleas on them?
Well, I'm glad that you asked that, because it goes back, to further answering the question about kids presenting with flea bites or fleas on them. And again, I think it behooves schools to have a protocol for fleas that they can give as an educational handout to parents. And so that's the most important thing, because typically, whether it's lice or fleas or whatever else, the parent will be the person doing the treatment, and so they need to have some education and a nice fact sheet, just like the one that we have for lice for school nurses. We should have for fleas, although I'm sure it would be used much less. So that's the number one thing. I, personally, fleas, if you see these fleas on somebody, on a child, they're not difficult to remove. The truth of the matter is, like Dr. Wakem said, that fleas don't really like being on humans more than to take a quick blood meal and then they're off. So I personally have never seen a person with a bunch of fleas. So, but if they recognize that a child has fleas or a flea on them, they do need to educate the parents, and it's good to have a fact sheet for that nurse, for the school people that go home. I might also say that I believe that when it comes to controlling fleas, whether it's year-round or not, that an integrated approach requires the verification that there are pests present. And so personally, if a home environment does not have fleas, and if the animal does not have fleas, then I always would rely on monitoring before I would ever begin treatment.
Thank you. This is a related question. Is there any way to tell if a student has flea bites compared to any other biting insect, such as bed bugs or something else?
Dr. Wakem answered this as well, but personally, I cannot tell the difference in bites. So welts or bites or itchy areas can be due to all kinds of different things, environmental factors. They can be bites, but it can be all kinds of different things. So I wouldn't be able to tell a person how to recognize a flea bite.
Another question, how do you use diatomaceous earth? Do you just sprinkle it around the environment?
Yes, well, typically you want to use it where the pests are going to be. Kind of the rule of thumb with diatomaceous earth is less is better. So what you want to do is try to get it in areas, cracks and crevices where the insect will actually have to rub against the diatomaceous earth and abrade itself.
Great.
That's the best way.
Here's one for Dr. Wakem. Why are pet flea products often counterfeited?
The market for flea and tick products for pets is a multi-million-dollar market. And, there are those out there who somehow find value in counterfeiting products and selling them through internet sales portals to unsuspecting pet owners at reduced prices. And the counterfeiters have gotten very clever in being able to copy both the packaging, the application devices, but unfortunately the contents of whether it be a spot-on liquid or a collar are absolutely worthless. So unfortunately, it is just the desire of some unscrupulous individuals to try to make money off a multi-million dollar business.
Thank you. Here's another good one for you, Dr. Wakem. I've heard that garlic added to a pet's diet is a deterrent to fleas because it makes their blood taste bad to the fleas. Is there any truth to this?
There is not. There are a lot of old wives' tales out there, a lot of folk remedies that may or may not have some basis in truth, but that is certainly one that has no scientific data to support it. There are so many effective and safely used traditional products that it's difficult to justify resorting to unproven, untested products like that.
Okay, here's another one. In the school setting, what host is usually the carrier or transfer vehicle in bringing them into the building?
In my experience, it's been humans bringing in pets that have fleas, most commonly ferrets. A lot of schools these days have policies prohibiting that, but not all. But that's really where I've seen the most. And then, of course, as I mentioned before, bringing companion animals like cats into other communities. One of the problems around schools historically has also been feral cats, and if they are allowed to infest buildings, even around buildings, that there will be a flea problem.
Okay, here's another good one. Any advice to staff giving guidance to homeless populations regarding avoiding bites?
This is a matter of the problem is that you want to distance homeless populations from other hosts, but that's very difficult because often homeless populations have pets that they need for companionship, and also homeless populations, unfortunately, can be associated with squalor, where rodents, particularly rats, can be around. So this is a difficult thing. It is a community education program. One of the things that I think should be done is what we did when there was a Rocky Mountain spotted fever outbreak in Arizona, which is to develop a control program using collars on dogs. So I won't tell you what collars we used or whatever else, but that would be probably one of the first things I would look at is flea management for those pets that are in the indigenous or in those homeless populations.
A number of animal health companies have stepped up and donated product to shelters, to animal welfare associations, whose mission it is to reach out into the community and help provide some basic health care to pets owned by homeless individuals. And so, by distributing and applying these products, that can offer one component of control that can hopefully mitigate some of the challenges posed by arthropod-borne diseases where the arthropods are resident on the pets accompanying the homeless people.
And
Yeah,
another thing I would add to that is, and this is one of what I perceive as a problem with the collars that that work for many months. Well, on the one hand, they're very good, and I like them. On the other hand, I personally believe that that is poor resistance management. So I think that your staff needs to have a surveillance program to make sure that that effective control is taking place and resistance is not occurring.
great. I have a question here. How often should one bathe a pet with pet flea shampoo?
Flea and tick shampoos are not a commonly used tool to control flea infestations any longer. Years ago, prior to the mid-90s, when our new modern products were introduced, shampoos, sprays, dips, powders were the only tools that we had to use. A shampoo can be an effective tool in removing the accumulated mass of flea dirt on the pet. They can also be used to help the pet owner get an idea as to how extensive the infestation is. But the insecticidal effect of a shampoo is fleeting. As long as the shampoo occurs, there's no residual effect afterwards. So there is benefit in starting with a clean pet, a clean flea-free pet, but then sustained treatment can more easily and more effectively be accomplished using one of the longer lasting and easier to apply topical products or orally administered products as recommended by a veterinarian. Now, the flip side of that question is, if a pet is receiving a topically applied EPA-registered insecticidal product for control of fleas, how often can a pet be shampooed while on that product? Because the active ingredients from that product reside in the superficial layers of skin and the fats contained therein, and shampoos, of course, will remove that. So most of the products that are registered by the EPA for that purpose have been tested with a single shampoo done midway during the month. And with a soap-free shampoo, in other words, a shampoo that is not harsh, contains strong soaps and detergents that will remove excess skin oils, the topical products are able to remain effective for the full month despite having a shampoo being performed in between. If a pet has a skin condition that requires frequent shampooing, then that pet owner should work with their veterinarian to find the ideal way to balance the needs of that skin condition and the needs of flea control. And again, with the wide variety of products on the market, that should not be a difficult thing to do.
Thank you. Here's a good one. Can community outreach workers pass fleas during home visits to other homes or environments?
That would be a rare occurrence at best. I've personally never seen that occur before. The fleas are really not so much like bed bugs that way.
Great. And another one, are fleas more likely to be more prolific in a home with carpeted floors compared to hardwood floors?
That's a common fallacy. In guiding clients through the management of their flea infestations, it was not uncommon to hear, denial statements such as, I can't possibly have fleas, my house has hardwood floors or linoleum. The fact is the presentation described just how small flea eggs are, just how small larval fleas are. It is possible for these environmental stages to find refuge in crevices, cracks, And so the absence of carpet in a home does not mean the absence of fleas.
Yeah, and further, you know, I always learned about fleas and flea larvae is you had to have detritus, dander, skin particles, all kinds of stuff like that, and that had to accumulate to some extent for that for the larvae to be viable. You know, so they had some food, and that's going to be in any crack and crevice. So the idea that that vacuum is not just a mechanical control, it's a cultural control in that it removes that food source by getting it out of those cracks and crevices, and that's an important thing.
Okay, we only have time for one or two more questions. Here's one. What are your thoughts on Seresto collars for dogs and cats?
The Seresto collar is a product that contains two active ingredients. One is designed largely as an insecticide and the other as an acaricide for ticks. It provides for 8 months of continuous control after it's applied to a pet. So when compared to other products, when other products are administered or applied according to schedule, the expectation is that all these products will work equally well. The benefit for the Seresto collar is that once put on a pet, it is effective for 8 months, whereas other products, of course, that are applied or administered monthly rely on a compliant pet owner to apply or administer those products. So again, with compliance being equal with all these products, the expectation is that they will all effectively manage the threat from both fleas and ticks.
Okay, and our last question. Can you use a flea collar while using Advantix?
So that would represent the use of two products on the same animal. Sometimes that is recommended by veterinarians when the pressure from the fleas and ticks is severe enough that one product may not necessarily satisfy that animal's needs. I mean, such a practice should only be done with the advice of a veterinarian. As with any medical action, the risks versus benefits need to be weighed, and the application of more than one product on a pet should be accompanied with a clear understanding of both the risks and the benefits to that pet. Personally, when I am hiking with my pets in the woods, I'm fortunate to live in an area where I have ready access to the forest, and it does pose a pretty significant challenge from ticks. I will sometimes use more than one product for spot control of the threat during different seasons. But again, I would recommend that any pet owner who'd be considering this reach out to their veterinarian for specific advice on that practice.
Well, thank you so much, Dr. Wakem and Dr. Lame, for your informative answers. And thank you, attendees, for your great questions. We now need to close this webinar. This is it for today. Thank you very much for attending. Goodbye.
Goodbye.
Thank you.